We're going to look at issues that may affect connective tissue proper, such as ligaments and fascia. The first thing we're going to look at are sprains. A sprain is an injury to a ligament. Ligaments connect bone to bone. They take a long time to heal because there's low blood supply. Ligaments don't rebound to initial length. They're prone to re injury, and they use force closure or muscular support to support the joint. There are varying degrees of severity, from tearing a few fibers to complete rupture. As they take a long time to heal, you will frequently have students come into yoga once they're out of the acute phase. So let's talk about an ankle sprain. The ankle is a common site for a sprain as it has many ligaments and is quite mobile. Here's a scenario. What kind of instruction might you give to a student with a healing lateral ankle sprain in a pose like Warrior 2, where the injured ankle is the back leg? Note, the position of the back foot and leg would exacerbate the stretching of the outer ankle. We want to make sure that there is a firm outer ankle. We want to avoid putting pressure on the outer foot. We want to avoid overstretching the area of the sprain. We want to shorten the stance to reduce pressure on the outer ankle. And we want to turn back the back foot out to reduce pressure on the outer ankle. We also want to engage the outer shin strongly to support the ankle. When we take a look at the knee ligaments and the ACL, the knee is a common site for a sprain, a ligamentous injury. The knee has 4 ligaments that connect and stabilize the joint. The most common ligament injury is tearing of the anterior cruciate ligament, or the ACL. This injury is usually caused by a traumatic knee twist. Like any other ligament, this injury can range in severity. Severe injury, like a tear or a rupture, may require surgery to reconstruct the ligament. Pre-surgery, students may lack knee stability. Post-surgery, students may have a stiff joint and more limited movement. The moral of the story: encourage students to follow the advice of their doctor or surgeon, minimize movement as needed, and focus on stability. When we look at other knee issues, we can see and know of things like runner's knee or the patellofemoral pain syndrome. This is the irritation and pain from the patella moving on the femur. We also have ITBS, iliotibial band syndrome. The IT band is a strong band of connective tissue that runs from the outer hip to the outer knee. There is tightness in the IT band, and it causes irritation as it crosses the knee to insert on the tibia. There's also meniscus wear and tear. The C-shaped cartilaginous disc between the tibia and the femur gets torn. It is not easily repaired, and this can be caused by wear and tear or a traumatic twisting injury. They often remove loose debris in the joint as a solution. Or you can also have a complete knee replacement. So, what may be some good common sense suggestions for a student who is suffering from an undiagnosed knee pain? We want to advise the student to stay in their pain-free range of motion. As a general rule, you will often avoid poses that involve intense flexion, like hero pose or saddle pose, and deep lunges. We'll treat the knee like a pure hinged joint, so no twisting, and the focus on the knee and the alignment. Be willing to back out of the poses where pressure is on the knee. Deep warrior, squats, and chair are some of the things that we'd be willing to back out of. Put a soft prop under the knee if there's direct pressure and it hurts. If we want to look at other sprains, where else could you experience a sprain? Anywhere there is a ligament is where you can experience a sprain. The most common areas include the back, where there's lots of ligaments along the spine, the wrist, where there's lots of ligaments in the wrist and at the elbow. Whiplash is a ligamentous injury. It's often caused by a car accident. Whiplash is a non-medical term to refer to an injury to the neck caused by a sudden or forceful movement. It gets its name from the whip-like snapping motion that occurs through the cervical spine. Often, it involves injury to the joints and soft tissues of the neck. Whiplash is actually the muscles of the neck contracting suddenly to prevent the head from excessive forward movement. What is a common sense advice or modification for whiplash? We are going to encourage students to avoid movements that hurt their neck. Instead, keep the neck in its neutral position or wherever it's comfortable. For example, no need to turn the head in triangle pose. And you want to modify poses with deep neck flexion, such as shoulder stand. The last thing we're going to look at here is the hernia. A hernia is when one part of the body, the organ and the fatty tissues, pops through a rupture in a containing wall of connective tissue or muscle. For example, the intestines poke through the abdominal wall. The hernia, a gap in the wall of the containing fascia, is often caused by overexertion and pressure. It may cause a bulge or some discomfort. However, more serious hernias are repaired through surgery. A hiatal hernia is an issue with the valve between the stomach and the esophagus, which can cause acid reflux and discomfort. So, what are common sense advice for students who have hernias? We want to avoid positions that increase discomfort or pain. We want to avoid creating internal pressure in that area and avoid movements that may exacerbate the issue by overstretching or compressing the tissue, such as deep back bends. We want to avoid creating intra-abdominal pressure by holding our breath after we inhale, and avoid rigorous pranayama such as kapalbhati.